Hello everyone, I hope that you are having a good day. And actually in the Netherlands now we have a really good weather. Today we have 28 degrees, so everybody is like really enjoying the weather. Everybody is out, having drinks in the terrace. So the restaurants are also open now, so there's a lot of things to do and to enjoy outside. And which is really great because we had a really bad weather in the past months, and we also had a very it was not nice spring because it was really raining and dark and cold. So at least at this time we can really enjoy the weather outside. I'm making this video because well, it has been a while actually that I made my last video, but this time I had my CT scan last week at Meander Amersfoort. It's one of the hospitals that is taking care of me. I have a shared treatment with AVL, so that's Anthony van Leeuwenhoek in Amsterdam and Meander, but I was diagnosed first in Meander and they referred me to Amsterdam. And so there were times, or the last two scans were done in AVL, and this is the third scan, the CT scan. The difference is the scan that I had with AVL, it's without the contrast, so without they will inject a fluid in my body to see, which because actually this fluid is to see more what you call that, it will be more accurate in that sense, because all the things, or all the organs that has an activity will light up in the scan. So that's the difference between having contrast and without the contrast CT scan. So I see without contrast CT scan, of course it will still be, you will still see a lot, but it's more, let's say, what you call that, it's more specific, or it's more clear what you have if there's a contrast on it. So so the one that they did in AVL, that was without contrast, and so far they gave us good news. And last week I had my CT scan in Meander, this time with contrast, and actually the result was also good. The doctor said that of course they see something in my liver, but because they have what you call that, because there's a contrast this time, so it's something that they're not worried about. And then she also said that maybe it's just really because we use a contrast in this CT scan, so there's like a little thing that lights up there, but it's nothing to worry about. They are confident that that's not something or the cancer is back or something serious. So nothing to worry. And in terms of my lung, because that's still one thing that my doctor in AVL said that it's still there, but it become really small. And this time she said that it's really small, that it's really hard for them to to see it and to be sure that that's it, because it was so close, or it is so close to the vein that they cannot it's hard for them to to segregate, if this is really it or not, or they know exactly where it is, where it was at least. And so for them that's the indication that it become really small, because it would be really hard for them to even spot it now with the scan. So that's actually very good news. And the doctor asked me how I'm feeling, and I said, well, this time I feel really good, since I've been taking Tagresso for the last since February. So February, March, April, May, and now we are June, so this would be my 5th month. I've never felt so good in the last months, you know. I feel like I'm really back with my old self. I'm able to walk. I cannot run, but still I can walk faster or normal. Of course, if I had already a long day, then I walk a bit stiff, but even then, you know, there is a little bit pain at my back, just a little bit, but it's manageable, so that's really good. And in terms of also with my bones, the doctor said that I can also share with you a photo of it later on after this video, but you can see in that photo that the before and after, the photo that they, or the scan, as you can see now, it's more, the lining of the bone is more visible, and it's more white as well, the bone itself, because in the scan it looks white if it's a healthy bone, of course. But if it's not healthy, or there's something wrong with the bone, it looks more grayish, more like a shadow. And in my scan before, that's what it looks like. It was really gray. Some parts of the bone, especially my pelvic side, here my hips, the right leg, the lining was already not visible. So that's why they were telling me, be careful with your leg, especially with your right leg. You cannot do long walks, you cannot put pressure in your legs, you cannot stand still for a long time, that the pressure is on this side. Yeah, so that's the reason why, because the most fragile part of my body is actually my bones. So but they are confident that because I am taking also, or they are giving me also Sumeta as part of my treatment, that's every 6 weeks. So my next infusion will be in July again. So, and that's to strengthen the bones. And the doctor prescribed me yesterday vitamins, a supplement, calcium with vitamin D, and she said that will really help the Sumeta as well. So together they can repair my bones, and hopefully because it's going to be a continuous treatment, that it will get stronger and better in the coming months. So again, this is my 3rd CT scan, and it has been since the first one, you know, and the second one was also good. The first one was really like we were blown. It was mind-blowing to know that some parts of it were gone, and I'm happy that in the 3rd scan it still shows some progress, and although the doctor said that they are keeping monitoring my blood, because that's when they see if there's any activity or there's any resistance that they will see in my blood, that they can act on it. And because of course the kind of cancer that I have, like what I mentioned before, is very rare and more complicated. I have 2 mutations, and they are giving me Tagresso as a treatment for only 1 mutation, and they are hoping that the other mutation will be treated as well with Tagresso. So with only 1 tumor pill that they can give me, because the other mutation they don't know much about. So so that's why they keep on monitoring my blood, if there's any activity, if there's any resistance that they can see, because as soon as they see something, they can act on it. And of course, the doctor also said that if it becomes more and become aggressive, then they can also maybe do some biopsy again to check how they can what kind of treatment they can give me, the best treatment that they can give me if that will happen. So far, for now, everything is looking very good. The cancer is you know, not active in that sense, and so they are also not spreading more in my body, so that's also the very important thing. And but still, again, for those that are wondering if this is the progress that I have been having in the past months, is this going to be then a cure for me in the next coming months? So if you cannot see the cancer in my liver, there's nothing in my lung, there's nothing in my brain, and you still see it in my bones, of course, but if that will also be less, then will I then be cured? And well, that's something that we can't answer at the moment. They can't answer. They cannot give me any answer. But the only thing that they keep on saying is that there will be no cure for me. So what they're doing is giving me treatment to what do you call that, to make the cancer cells less active, or not, you know, not be active until such time that they get resistant to the medicine. And for when, we don't know as well. So we just keep on having the scan every 6 weeks, getting the Sumeta infusion every 6 weeks, and keep on monitoring my blood if there's any resistance, and act when it happens. So yeah, so unfortunately, that's still the fact that there is no cure for me. Although we all, my family and everyone, you know, close to me are praying and hoping for a miracle. I am also hoping for that, but you know, I am taking it a day at a time. This is already good news for me, for my family as well, because it means, like what I said also in my previous videos, it also means that I have more years with them. And with the life expectancy of, in the beginning, of 9 to 12 months, the doctor said that with the progress that I'm making right now, it is, they can say that it will take 2 to 3 years at least for me. Yeah, and of course, we are hoping that it will be more, but hearing another year and another year added in my life is already something I am very, very happy about. So yeah, I guess that's it, you know. I am very happy about this, and I just want to keep on updating you guys, because I know that you are also curious what's going on. Although I would like to say that for those that are wondering, the Tagresso has I don't know if anybody is taking Tagresso or watching this video is taking Tagresso, but in my experience, the side effects that I have right now, of course, the pimples. I have pimples on my face, also some in my body. I have like every week I have a day or two that I have diarrhea. Not very nice to say, but that's one of the side effects. And what I notice is that I've been having hair fall, a lot of them, as in hair loss. And actually, it's not very visible, but I can already see, I can already, yeah, I can already see it. I can feel it. My hair is becoming thinner and thinner. and here also, as you can see, it becomes thinner. So it's not that obvious yet, actually. I used to have long hair, and I cut my hair, so, and I tried to blow dry my hair so it always looks like with volume and full. But actually, in the past weeks I've been saying to my doctor that is it also a side effect of the Gresso, because it's not mentioned, at least in the beginning, but I've been experiencing it for a while now. So if that happens, of course, the doctor also told me if I will lose my hair, it's also an option for me to get a wig, and that will also be part of my insurance. But yeah, at the moment, I don't know. I would like to enjoy my hair while they're still there, and then maybe I will cut my hair when it's really becoming really thin, you know, that you can really see the scalp already. But for now, I think I still have more hair. I don't need it, but yeah, it's if I would be feeling the same and losing my hair, I don't mind. I don't mind to be bald, as long as I am still I am still feeling the same. Like now, I can do the things that I used to do. I can go back to my business, you know. I can work again. I can basically do like normal people, you know, do what I want to do. So I don't mind. It's just a hair. At the end of the day, you know, hair is part of, it's always nice when a woman with a long hair, of course, you know, but at the end of the day, it's all aesthetic. And yeah, I don't mind, you know. If I haven't decided yet if I want to have a wig, because I don't think I would. It's nice to know that they are supporting cancer patients with it, but I don't think I'm gonna like it. I don't know. I mean, if I would be bald because I am sick, then I'm bald, you know, and I'm not ashamed of it. And if people will tell me that I look ugly with it, and yeah, so, you know, I mean, as long as I'm alive, I'm okay. I mean, it's just a hair. But yeah, and it does, for me, it doesn't matter, honestly. Anyway, yeah, so I guess that's it, guys. I don't know if you have anything in particular that would like me to tell you, but yeah, about my condition, I've been feeling really great. I'm still taking pain reliever, oxycodone. It used to be 2 times per day, but I am only taking now for 2 months, since April. I am only taking 1 oxycodone per day and nothing else for the pain. So that's also very good news. And yeah, the doctor also said to me, you know, because I asked people with lung cancer, EGFR mutation, and taking Tagresso, are their progress also this fast, you know, because it was just after 6 weeks of taking it, I already feel good about myself. I can walk again. And then she said, yes, actually this Tagresso is really proven to be effective with people with lung cancer with EGFR mutation. So I am happy that I'm I'm here, and I'm enjoying this treatment. And yeah, for now, we don't know again, but let's hope for the best, guys. And I want to thank everyone for praying with me, for staying with me in this journey. And let's always aim for that miracle to happen. I hope you guys are having a lovely day. After this video, I'm gonna share some photos of what I did in last week with the CT scan, and also with what the doctor showed me about the bones. I hope that also helps other people out there who are struggling the same. And I heard that there are also people with their mom or their relative with the same as mine. So yeah, good luck, guys, and thanks again, everyone, and I will see you again soon. Bye.